Now, pressure in physiology. This is a general term that applies to not just gases, but blood pressure and concentration gradients and whatnot. So things move from high to low pressure, not just blood pressure, but also air pressure and gas pressures as well. So how does pressure change in the body? Well, remember our blood vessels, they can change pressure by doing vasoconstriction and vasodilation, right? Similar concept with your lungs. By changing the volume of your lungs and your alveoli, you can change the pressure in your alveoli. And this Boyle's law. It describes this relation between changing the volume of something and changing the pressure of the gases inside that vessel. So what we have here is that volume is inversely proportional to pressure. That means, so when it's inversely proportional, as this gets bigger, this gets smaller, or if this gets smaller, this gets bigger. So instead of they're both getting bigger at the same time, or both being or decreasing at the same time, as one goes up, the other goes down. As one goes down, the other goes up. So that's an inverse proportion. And so this is what happens. As volume increases, pressure decreases, and as volume decreases, pressure increases. So again, they don't go the same direction. And this is another formula that describes it in mathematical terms. If you have a starting pressure and a starting volume, then if you change the volume of that vessel that contains a gas, or in terms of like liquid, you can also use that as well, it's going to change that as well. So actually, let me dial back that liquid part because it depends. Liquid dynamics are a little more complicated. But this is what we have with gases. So things that your gas particles, even if they're in an enclosed vessel, they're bouncing around, they're moving around. That's what we see here with these arrows and vectors. So these gas molecules are buzzing around and colliding with each other and bouncing around this vessel. But what happens if you push this plunger down and decrease the volume inside this vessel? Well, notice that these particles are more closely smushed together, right? So they're going to collide with each other and also going to collide with the sides of the vessel more. So what happens is that when we went from that relatively large volume to a smaller volume, that increased the pressure. Now, in the before times, say you're an introvert like me, and then you end up in like this guy. See this? You see this guy right here? He's not having a good time. He wants to socially distant, right? Because there's way too many people in here. Well, say another room opens up next to him. So what happened here? He's stuck in this initial room, but by increasing the volume, what happens? Well, people who don't like being crowded, they might flood into this open room right here, right? And maintain their distance from other people. Like still be social, but still be distant. But that's kind of like your particles in a gas. If you have them in a very compressed area, and then you have all of a sudden open some things up and make the volume larger, the gas particles are going to leak to the area of lower pressure. And that's what we have here. This guy's experiencing a lot of pressure around him, but if you open an area with less pressure, a lot of people and a lot of particles are going to move to the area of lower pressure. Okay, so then we have to talk about pulmonary ventilation. So remember, things move from high to low pressure. This is going to carry you a lot through respiratory physiology. Now, this is at your rest prior to inhalation. So this is before you're inhaling. You're not actually moving any muscles. You're not changing the volume of your lungs. So what we have is the pressure on the outside is equal to the pressure inside. So does that mean nothing is moving at all? Well, you still have diffusion, but in terms of your overall movement, just as many particles are entering as they are leaving. So you have equilibrium. It's not going to cause an overall change in volume either. So no really net movement. That's what we're talking about. So again, you're not going to have more particles entering your lungs. You're not going to have more gas particles leaving your lungs if the pressures are equal outside and inside. Now, when is your body like this? You might be like, does this actually happen in the body? Well, it does. It happens, but you're not necessarily aware of it. So there is a brief moment when this happens. So you're like, okay, I can exchange. So your friend tells you, I can exchange gas without moving my lungs. And you're like, wait, how do you do that? And this is how you're able to do that. When is pressure outside equal to the pressure inside? You just open your mouth. Don't breathe, don't move anything. You still have diffusion, but things that, are your lungs going to collapse? No. Are they going to inflate? No. Do you still have movement of gas particles? Yes, but can you just keep your mouth open like this and stay alive? Eventually, you'll need to speed up the process and breathe. So again, you can open your mouth and have gas exchange, but it's not going to be at a fast enough rate to dump out the carbon dioxide and bring in enough oxygen you need. Now, let's change the pressure. Let's change it by changing the volume of our lungs. Now, what you do when you inhale is that you expand your lungs. And how do you, so you're going to inhale and expand your lungs, increasing the volume. And remember, volume and pressure are inversely proportional, right? So as you increase the volume, you decrease the pressure. So as you decrease the pressure, what happens is that now you have the pressure in your environment is greater than the pressure inside your lungs. So let's ask the few of you who are in the chat, thank you for showing up. So if the pressure is greater on the outside and the pressure is less on the inside, which way will the air move? Toward the inside of your lungs or toward the outside of the lungs? Yeah, it looks like so a lot of you are getting it. So again, if it's greater on the outside, remember it moves from high to low pressure. So you're going to have air moving in. So yeah, and someone said it's a weak vacuum in the lung, so it would go in. And yes, that's what's happening. You're creating a vacuum, it's going to move air in. So this is how you speed up that process of gas exchange. So again, you're increasing the volume, decreasing the pressure. This is how you're able to inhale. Now, let's do the reverse. Exhalation. What are you going to do? Instead of increasing the volume of your lungs, now you're going to decrease the volume. You're going to collapse your lungs, not all the way, but you're going to shrink the volume. And by shrinking the volume, it's just like squeezing that bottle, right? You're going to increase the pressure. So decrease volume, increase pressure, that inverse proportion. Now, what happens? Where will the air go? From the inside towards the outside or outside toward the inside? Yep. So as people are saying in the chat, yes, it'll go toward the outside. So again, it's something that seems so basic, but again, this is what's so beautiful about your lungs and the physiology. You just change the volume of your lungs, you can inhale and exhale. So again, with the increased pressure inside the lung, it's going to force air out toward the outside. So again, by collapsing and partially constricting and collapsing your lungs, you're going to force the air out of your lungs. Now, this is the Martini version, and they talk about how your lungs are able to increase in volume and decrease in volume. And the example they use is a bucket, and to be honest, I don't really get this bucket example. I'm like, how does this bucket relate to this? I don't get it. So what I think they're getting at is that the handle of the bucket is kind of like the interface between your vertebrae and your ribs. So what's happening, I think of it like a door knocker. So these ribs right here, they articulate and form a joint with your vertebrae. So the thing about your ribs, they can pivot on your vertebrae and swing upwards and downwards to elevate your rib cage overall. So I found this really cool video, and it's a camper trailer, but what happens is that this little trailer, it can increase its roof size by lifting it up. So if this roof lifts up, what happens to the overall volume inside this little trailer? Well, as that roof lifts up, it's going to increase the volume inside that trailer, right? So that's why I like to liken it to. So what's happening here, by lifting your rib cage during inhalation, by using their muscles to inhale and lift your rib cage, that increases the volume inside your lungs. So just like how the roof of this trailer is lifting up to create more volume, same with your rib cage and your lungs. So by lifting, that causes more volume. To animate it very crudely, what we have here is not only the rib cage, but we also have a flat sheet of muscle we call the diaphragm. Or relatively flat. It's a sheet of muscle. But what happens is that as we inhale, notice that the rib cage is starting to lift, but the diaphragm is actually contracting at the same time. So when the diaphragm is relaxed, it's actually pushing up and into your lungs a little bit. But as it contracts, it starts to flatten out and create more volume. So as it starts to constrict, as you lift your rib cage up here and also contract your diaphragm, it starts to create more and more volume for your lungs. So this is what happens when you're fully inhaling. You have all this volume for your lungs, but you also have a little more volume because your diaphragm is no longer pushing up and against your lungs. But when you exhale, what happens? Well, you're going to flatten your rib cage, but also the diaphragm is going to give a little push from the bottom of the lungs and push up against the bottom inferior part of your lungs to help give a little boost and exhale extra gas as well. So just repeat the cycle. Lift your rib cage, flatten your diaphragm, and then when you exhale, you flatten your rib cage, and then you also relax your diaphragm. Okay, and this is the OpenStax version, and I think it shows it a lot more simply than the Martini version. So again, expiration, notice that the rib cage is collapsing and the diaphragm is relaxing, so it's doing that upward motion, kind of like doing a little small, it's not like a total uppercut to your lungs, but it is providing a little boost. But when you inhale, what happens is that the diaphragm contracts, allowing the lungs to expand a little on the bottom, but the rib cage also lifts out and up, thus creating more volume, thus dropping the pressure inside the lungs.